Great Day Houston and Star Furniture have teamed up to honor some of Houston's finest educators. Do you know a teacher who deserves the Red Apple Award? Visit khou.com/Red Apple now to nominate your favorite teacher, and they can be honored live on Great Day Houston. Welcome back to Great Day Medical Monday. Joint pain affects millions of Americans, taking away the ability to do something as simple as walk with comfort. But there's a solution. Welcome Dr. Adam Freedhand, orthopedic surgeon with Memorial Hermann Joint Center, to tell us what we can do. Hi there.
Hi, thanks for having me.
All right, so this is one of those areas, too, where research and things have happened, and people might not realize it since their parents or grandparents had joint replacements. So we're going to go through kind of a little true or false game here with you guys to see if you understand what things have happened here. Lots of misinformation out there. The first is true or false, joint replacement affects people mostly 50 years old or older. True or false? Y'all saying false.
Smart group.
Okay. All right. I would have thought that was true. I would have gotten that one wrong.
No, I mean, joint disease, for a variety of reasons. There's the wear and tear osteoarthritis, which is the most common form of joint destruction, but there's also all kinds of inflammatory arthritic processes that strike people when they're younger. So we have patients that are anywhere from their 20s sometimes up until their 90s. So, you know, the concept of you have to be a certain age is really not true.
Yeah, yeah. And then what about injuries? Would that
so injuries actually predispose to arthritic changes down the line. So probably you guys have all heard about ACL injuries. Yeah. So sports injuries such as an ACL tear, very commonly those joints become arthritic, knees in particular, you know, 15, 20 years down the line.
All right. True or false? Joint implants normally last a very long time. True or false? We got a trolls.
That was a mixed bag.
Yeah, trolls. They said trolls. Yeah.
Yeah. They do last a long time, and in fact, if you look at the joint replacements that are in at about 15 to 20 year interval, 90% of them or more are still in and working. So people sometimes, and I hear this in my office all the time, they say, well, it's only going to last for 10 years. And I say, where'd you get that information from?
Right.
It's just not accurate.
Yeah, and there's new materials in there today, too.
Yeah, so our manufacturing processes have gotten better. And some of the implants that we're using now look like they're going to last 30-plus years.
Yeah, and even the point where instead of doing a total knee replacement, there are just parts that you can replace sometimes too,
so
right?
I brought a model here. That's a very common misconception. People think that a knee replacement is kind of an amputation of the middle third of your leg, and it's really not. It's really a resurfacing operation. You can see this model here. And I'm not going to move that much so you can see it, but it's a very thin metal implant that we sculpt the bone and place this on the bone with. And this is a robotically assisted
And with
procedure.
that metal, I would imagine things glide and slide very easily.
Exactly. Yeah, the friction between the plastic piece and the metal piece is almost negligible.
Yeah. All right. True or false, you should visit a doctor once you can't walk anymore.
False, exactly. So the main reason people come to my office is pain, but also functionality, being unable to walk and get around. And if you wait to the point where you're that disabled, you're doing yourself a disservice. You know, it's interesting that the majority of people that have joint pain don't seek medical help because they're afraid of what they might be told.
Yeah.
And not all treatment is surgery.
But at what point do we do that? Like, so, you know, sometimes you know, if you're taking pain medication all the time, if you're getting the shots all the time, or when do you come in?
If you have persistent pain and swelling that's interfering with your ability to enjoy your life, I think that's when you seek medical help.
At least to know what you need. As you said,
exactly.
a lot of times you might not need the replacement. It can be something else done.
I think people think we're going to club them over the head and make them have surgery, and it doesn't work. It doesn't work that way.
And they don't. They don't. He didn't do that. I went in because I was having issues, and I went in flats, and now, as you can see, I don't know if you can see that. Here.
There you go.
There you go.
That's a shoe.
Yeah. All right, now I can walk around. Okay, true or false, joint replacement recovery is long and painful. And this is one of those things of when you saw your parents or grandparents going through things. So true or false, long and painful, joint recovery surgery? False, yes.
Exactly.
Times have changed.
We've gotten a lot better at taking care of and managing patients' pain. In fact, you know, if you look only 10 years ago or so, we used to be really kind of reactive to treating pain. We're much more proactive now. So we give medications before surgery, we give medications during surgery, we give different types of medicines because pain is not just one thing. There's many different cellular mechanisms that the brain perceives as pain. So we treat that proactively to make the recovery easier.
Yeah.
Another kind of misconception is that these surgeries take 4 to 6 hours. Most joint replacement surgeries actually take less than 1 hour.
For the whole joint replacement, wow, that's amazing.
And most of the time the patients are in the hospital only one night and go home the following day.
And you're up and walking sooner than maybe you used to be.
You're up and walking the same day.
Wow. Yeah. All right. So there you go. So in other words, what he just said is don't put it off. Get it
Exactly.
done, because it does impact your quality of life. And as we know, especially as folks do get older and they get sedentary, things just kind of go downhill from then. You're like shut in. You don't get out and enjoy things like you used to. So this gives you your freedom.
You have a way to make people happier and lead healthier lives.
And get them back into high heel boots.
Absolutely.
Thank you, Dr. Freedhand. To book an appointment with Dr. Adam Freedhand, call this number at 713-272-1888, 713-272-1888, or log on to jointpain.memorialhermann.org.